to start with Louisiana, Susie Sonnier, who is Secretary of DFCS in the Louisiana version. She was named this position in 2012, but she has had service in the department going back to 2008, and many other credentials that I hope that you will refer to in your packet. As I said, Louisiana has not privatized its child welfare services beyond the contracts that most states, 80–90% of states, have to deliver various kinds of services for foster care, family services, or whatever. And so this is a challenging task for these folks that are responsible for so much service in our child welfare systems, to hold their comments to 5 minutes and to really try to help us understand, based on their experience, what should we as Georgia be asking, what can we learn from the reforms that they have implemented in their states.
Thank you so much, Lynn. Pat and Lynn, you did a great job. You were extremely passionate about it, and so I hope that I can follow with as much passion. My name is Susie. It's a pleasure to be here, and I think what speaks most volumes to me as I sit in this room is the infrastructure that exists just by the passion and the commitment of each of you to be here. As a secretary of a department that serves hundreds of thousands of people and works with lots of people who have different perceptions and beliefs and values and ways that they want us to serve, it's really exciting to see all of you here today. And I know and have full faith that with your true investment and your true commitment and questioning and looking at, as Lynn really spoke to, what is it that you want to see for the children of Georgia? Y'all are going to have great things ahead of you. I really believe that. So thank you for the opportunity to be here. I certainly want to compliment and thank Casey as well. Casey Family Programs has been a great partner for Louisiana's Department of Children and Family Services. And I think the other thing that I had thought about and didn't realize that Lynn was going to spend as much time on is about the fact that it really is a system. There's not one thing we can do, even if I had the best staff in the entire world who all had the most training they could ever have and gave every hour of their life to child welfare services, we would not be perfect. And I think that that's something that I really think about all the time. We are incredibly dependent on our partners. We're incredibly dependent on district attorneys, court systems, advocates, CASA volunteers. All of those partners have a role. Each one has a very, very important role, and it's the role that we play together, fighting for safe and thriving children and families that ultimately is what makes a difference to me in Louisiana, and certainly I think here in Georgia. Louisiana is we're very proud of the fact that we're one of 4 COA accredited state agency, child welfare agencies. We fight very hard for that national accreditation. We believe in it. It sets a standard of excellence that I know that I can carry throughout my staff, that we can really want to be and continue to thrive to be a continuing learning organization, but one that has high standards and that fights to maintain those standards. And I think certainly that fight to maintain those standards, as we all around the country have faced diminishing budgets, as we all around the country have faced, just ongoing and increasing terrible things that we see within our families with substance abuse or other issues that we see in families. The job of a child welfare worker, I believe, is one of the hardest jobs in the country. To go into homes where there may be drugs on the table, they don't carry guns, they don't have the training that maybe our law enforcement folks have, and to determine whether or not a child can be safe to remain in that home, or whether you have to make the decision to remove that child from that family, I think is one of the most difficult decisions out there. And I think that we have to do it in partnership with lots of people and lots of great partners. Louisiana we do have a number of public-private partnerships. We certainly don't have, I've read the legislation that was recently submitted, I guess, in the legislature. We certainly don't have that level of public-private partnership that's being considered here in Georgia. But we do have public-private partnerships. We have a centralized intake line in Louisiana that we initiated over the last couple years that we think really does bring about consistent consideration of the level of reports and what we need to do to respond to those reports. But we do it in a public-private partnership with our customer service center that's run by Xerox. So we have a vendor who does that. We use all of that technology, but then our staff actually answer the phones, take the calls, and have a level of training. We actually have all teleworkers that run our centralized intake. So we've seen a lot of neat activity around that, but most importantly, we really can demonstrate through our data a consistent approach to the responses to the calls that we receive and how we handle those. There was always the question if each county or each parish in Louisiana had the same level of what they accepted and what they didn't accept. And so we've seen a lot of consistency. We've also deployed in Louisiana something we call advanced safety. We did that with the National Center for Permanency that we worked with, so that we really look at safety issues across the board. There's 6 safety questions that we really work through, and we use those same safety framework in our centralized intake, but also when it gets to our child protection investigation workers, and then again we repeat that in foster care. So that we are looking at the same framework regardless of the type of person or caseworker that is working with our young people. We also, thinking about public-private partnerships, certainly have a great partnership with our Department of Health and Hospitals, where we've implemented some work around, we have a managed care contract for our behavioral health partnership, and that has allowed us to really grow and strengthen with some Medicaid resources some of the services that our children and youth need. And so we certainly have increased some of our evidence-based practices, our FFT and MST and intensive home-based services through that partnership. We also have integrated our residential services into that partnership, and so we've been able to grow some of the deep-end residential services that are needed. That partnership just in the last couple of years has served much broader than our system, but 79,000 kids, and provides and offers over 5,000 different types of services. So it's really been critical in that partnership with our health system to develop that capacity. One of the things that we launched just this last year in April, and it's one of the things that I'm very proud of as well, is our Faith in Families initiative. And so if you talk to child welfare workers probably around the country, they believe that every other person who comes into leadership has a new reform, and that it's just one more reform again. And how do they keep up with these reforms? And is it going to be different? And are we going to see different outcomes? And so because I had been in our department before, I didn't feel like I could launch something completely different, right? Because I've been there before and was part of it, but I knew we could grow stronger, and I knew we could continue to make improvements and build on the things that we've been doing. And so we launched our Faith in Families initiative with 3 goals. One is to reduce the number of kids that are in foster care by 25%. That's significant. It's 1,000 kids in Louisiana. This is a 3-year initiative, so it will take us a couple of years to achieve it. But we saw that we had a very high percentage of kids who spent 30 days in our system. 30 days. So you remove them. You go through all the trauma of removing a child from their family to spend 30 days in foster care. We really felt like we could do more to reduce that. And let me say safely reduce the number, because we also have measures on the back end that we're looking at to make sure those kids don't come back into care. So, we really want to look at safely reducing our number of kids in care. The second thing we focused on was reducing the time they spend in care. Clearly, if they come into care, if we need to be very good at making decisions. If they're going to be able to be reunited with their family, let's do that in 12 months. Let's increase the number of kids that really have that happen. And if they can't, if they're going to be free for adoption, let's get them adopted within 24 months. And so we really focused on that throughout the state as well. And then our third goal was that no child should exit the foster care system without a permanent connection. And so that was it's been a very important goal for us. We have increased, adoptions. We've steadily increased our adoptions, and we've begun to work on all these goals. We've seen the most progress, I think, in the number of adoptions. That was one where people could really focus on and look at. There's a lot of kids that really are already in adoptive placements and are ready. And I see my cue on the time. But what I want to say about Faith in Families, and I think that's really, really important, is we don't have a mandate for public-private partnerships, but we've been able to create some really exciting ones without that, and I think yet still have a strong state system. And so with Faith in Families, some of our faith-based organizations were very, very excited about that. They have created a commitment to have 100 kids adopted in Louisiana through partnerships with 100 different churches in Louisiana. We've had pastors' breakfasts. We've had, they did an event called Over the Edge where we scaled off of one of the tallest buildings in Baton Rouge to raise awareness for adoption. Oh, well, no, they had a lot of people, including Les Miles, the LSU coach. So, that was a really big deal to see Les Miles sail over the edge for kids in foster care to be adopted. So, I just want to say, that there can be great, powerful relationships and partnerships that should be a part of a system that is diverse as our child welfare system. So, thank you.